I have a question about quality control. Do you still use back translations as quality control in life science projects? If yes, does it work for all languages, and does the cost of back translations pay for it? And if not, what quality control systems do you use in life science projects?
Okay, well, I think that the most common use of back translations in my company is for submission materials. So let's say you need to translate a document that goes to a government body. Or it may have been written in Portuguese originally. When it gets translated, that's where we would use back translation. But in the case of manuals and IFUs, instructions for use, we're not using that currently. I know that there's a trend in the industry to have back translations, and in some cases, some companies are saying, we're not doing an in-country review at all because we don't think it's worth it. And the reviewers aren't giving us valuable data or input into changes. So we're eliminating that, and we're going to go down this path of offering going through back translations and using the translation agency for that whole process. But I should step back and say that too, if that entity does require some sort of in-country review, and it has to be certified in some way. So that means that in our case, what we consider certification is we've got an application that everybody logs into. It's the same one. They go in, they attest that this is a valid translation, but they at the same time upload their changes and everything centralized. Other companies use different techniques. It could be as simple as signing a sheet of paper or an email message, but that is a requirement. So that requirement, because it's much higher in Europe than it is in Latin America, it still applies in Latin America because our company follows the highest standard. So it positively impacts the translations that come here. So I hope that answered your question. I don't know if you have
we do back translations, especially it's if you're in the clinical phase or in the pharma business, you're required to do back translations. The good thing is that clients for whom you're doing these back translations are aware of the tremendous cost that's associated with that. And some go even further. They have two translators translating it into target language, and then two different other translations, number 3 and 4, translating it back. And for Europe and for our pharmaceutical customers, we distinguish the medical device customers from the pharma customers. And let's say the pharma customers do get a quote that includes that particular service. But it's very costly, very costly.
Very short, also for you too. You are mentioning at the beginning that is a difference across the countries of Latin America as far as regulation is concerned. It's not like North America or EU regulation are more uniform. How do you cope also with the difference in terms of application of rule of law? For example, we are observing, for example, in Venezuela, for example, expropriation sometimes happen, or infringement of patents, or sometimes ago, for example, in Brazil, during the last pandemic, for example, they were talking about suspending, for example, the patents of the vaccination for the reason, whatever the reason be. How do you cope with this kind of change or unexpected change of the equation? Because I guess this really impacts a lot of your P&L.
To a certain extent, it does depend on the size of the market. We're talking about Brazil, and there's heavy negotiations and with the government. If we're talking about a smaller market, then the unfortunate reality is that if it's not in the best interest of the company to do business there because of some infringement of patents or other misuses of the product, then the company will say, they'll approach the government or maybe the local distributors and say, we'll cease doing business in your market if you don't rein this in, if you don't make changes. So there's it's playing hardball with, this is just the reality of the situation. So if it's a large market, then